sprayed-on ceiling texture, particularly the popcorn type with glitter applied before the 1980s, frequently contains asbestos. When cutting holes in ceilings suspected of containing asbestos, it's crucial to take certain precautions. Firstly, wear disposable coverall, gloves, and a National Institute for Occupational Safety and Health approved N-95 or P-100 respirator. Secondly, wet the area before cutting to minimize dust dispersal. Thirdly, cut small holes slowly and carefully to further reduce dust generation. Fourthly, seal the edges of the hole with duct tape immediately after cutting to prevent dust from escaping into the surrounding environment. Fifthly, use a high-efficiency particulate air HEPA vacuum cleaner to thoroughly clean up the area after the work is completed. Finally, have the area tested for asbestos by a qualified professional to confirm its presence and to ensure that the cleanup efforts were effective in removing the asbestos fibers. It's also important to be aware of other potential sources of asbestos in homes. One major source is insulation. This includes vermiculite insulation, often found in attics and walls, pipe insulation commonly used on heating and plumbing systems, and duct insulation used to wrap air ducts. Secondly, flooring materials can contain asbestos. Vinyl floor tiles, sheet vinyl flooring, and the adhesives used to install these materials may all contain asbestos fibers. Thirdly, siding can be a source of asbestos. Asbestos cement siding, which was popular for its fire-resistant properties, is commonly found on older homes. Fourthly, roofing materials can contain asbestos. Asbestos cement shingles were used on roofs for many years. Fifthly, drywall construction sometimes utilized asbestos. Joint compound and tape manufactured before 1980 may contain asbestos fibers. Sixthly, textured paint might have asbestos. Some older textured paints applied to walls and ceilings may contain asbestos. To protect yourself from asbestos exposure, remember to avoid disturbing asbestos-containing materials unless absolutely necessary. If you must work with asbestos-containing materials, be sure to take appropriate precautions as previously discussed, including wearing protective gear and using wet methods to minimize dust. For any significant removal or repair work involving asbestos, it is best to hire a licensed asbestos abatement contractor who has the training, experience, and equipment to safely handle and dispose of asbestos-containing materials. If you suspect that asbestos is present in your home, it is advisable to have it tested by a qualified professional. They can collect samples and send them to a laboratory for analysis to determine the presence and concentration of asbestos fibers. Regularly clean and maintain your air ducts to minimize the risk of exposure to asbestos fibers that may be present in old insulation. By taking these precautions, you can minimize your risk of exposure to asbestos and protect your health. Asbestos is a naturally occurring mineral fiber that was widely used in building materials for much of the 20th century due to its strength, heat resistance, and insulating properties. However, it was later discovered that exposure to asbestos fibers can cause serious health problems, including lung cancer, mesothelioma, and asbestosis. Because of these health risks, the use of asbestos has been significantly restricted in many countries, including the United States. Despite these restrictions, asbestos-containing materials are still present in many older homes and buildings. When asbestos-containing materials are disturbed, such as during renovation, demolition, or repair work, asbestos fibers can be released into the air. These fibers are microscopic and can easily be inhaled. Once inhaled, asbestos fibers can become lodged in the lungs and other parts of the body, where they can cause inflammation and damage over time. The health effects of asbestos exposure can take many years to develop, often 20 to 50 years after the initial exposure. This latency period makes it difficult to link asbestos exposure to specific health problems. The severity of health problems caused by asbestos exposure depends on several factors, including the amount and duration of exposure, the type of asbestos fibers, and individual susceptibility. There are several types of asbestos fibers, including chrysotile, amosite, crocidolite, tremolite, anthophyllite, and actinolite. Chrysotile, also known as white asbestos, is the most common type of asbestos found in building materials. Crocidolite, also known as blue asbestos, is considered to be the most dangerous type of asbestos. Mesothelioma is a rare and aggressive cancer that affects the lining of the lungs, abdomen, or heart. It is almost always caused by asbestos exposure. There is no cure for mesothelioma and the prognosis is generally poor. Lung cancer is another serious health problem caused by asbestos exposure. Asbestos exposure can increase the risk of developing lung cancer, especially in smokers. Asbestosis is a chronic lung disease caused by the inhalation of asbestos fibers. It causes scarring and stiffening of the lungs, making it difficult to breathe. There is no cure for asbestosis, and it can lead to disability and death. If you are planning to renovate, demolish, or repair an older home or building, it is important to have it inspected for asbestos-containing materials. A qualified asbestos inspector can collect samples and send them to a laboratory for analysis. If asbestos-containing materials are found, it is important to have them removed or repaired by a licensed asbestos abatement contractor. Asbestos abatement is the process of removing or encapsulating asbestos-containing materials to prevent the release of asbestos fibers into the air. Asbestos abatement contractors are trained to safely handle and dispose of asbestos-containing materials. They use specialized equipment and techniques to minimize the risk of asbestos exposure during the abatement process. Encapsulation is a method of sealing asbestos-containing materials to prevent the release of asbestos fibers. Encapsulation can be used when it is not possible or practical to remove asbestos-containing materials. It involves applying a sealant to the surface of the material to create a barrier that prevents asbestos fibers from being released. If you are not sure whether a material contains asbestos, it is best to assume that it does and take appropriate precautions. This includes wearing protective gear such as a respirator, gloves, and coveralls, and using wet methods to minimize dust. You should also avoid disturbing the material as much as possible. Never sand, cut, drill, or otherwise disturb asbestos-containing materials without taking proper precautions. These activities can release asbestos fibers into the air, which can be harmful to your health. If you are concerned about asbestos exposure, talk to your doctor. They can assess your risk and recommend appropriate screening tests. There are also many resources available to help you learn more about asbestos and how to protect yourself from exposure. The Environmental Protection Agency (EPA) and the Occupational Safety and Health Administration (OSHA) both have websites with information about asbestos. You can also contact your local health department for information about asbestos in your area. By taking steps to protect yourself from asbestos exposure, you can reduce your risk of developing serious health problems. It's important to remember that asbestos-containing materials are not always easy to identify. They can be found in a wide variety of building materials, and they may be hidden behind walls, ceilings, or floors. If you are not sure whether a material contains asbestos, it is best to have it tested by a qualified professional. When working with asbestos-containing materials, it is important to follow all applicable regulations and guidelines. These regulations are designed to protect workers and the public from asbestos exposure. Failure to comply with these regulations can result in fines and other penalties. In addition to the precautions already mentioned, there are a few other things you can do to protect yourself from asbestos exposure. Firstly, always work in a well-ventilated area. Secondly, avoid eating, drinking, or smoking in the work area. Thirdly, wash your hands and face thoroughly after working with asbestos-containing materials. Fourthly, dispose of asbestos-containing waste properly. Asbestos-containing waste must be disposed of in accordance with all applicable regulations. Finally, if you experience any symptoms of asbestos exposure, such as shortness of breath, coughing, or chest pain, see a doctor immediately. Early detection and treatment of asbestos-related diseases can improve the prognosis. While the dangers of asbestos are well documented, it's important to approach the issue with a level head and avoid unnecessary panic. Many homes built before the 1980s contain asbestos-containing materials, but the risk of exposure is low if the materials are in good condition and are not disturbed. The key is to be aware of the potential risks and to take appropriate precautions when working with or around asbestos-containing materials. Remember that asbestos abatement is a specialized field, and it is best to hire a qualified professional for any significant removal or repair work. Attempting to remove asbestos-containing materials yourself can be dangerous and may actually increase the risk of exposure. A licensed asbestos abatement contractor will have the training, experience, and equipment to safely handle and dispose of asbestos-containing materials. They will also be able to ensure that the work is done in compliance with all applicable regulations. When choosing an asbestos abatement contractor, be sure to check their credentials and references. Make sure they are licensed and insured, and that they have a good track record of completing projects safely and effectively. It's also a good idea to get multiple bids from different contractors before making a decision. This will help you ensure that you are getting a fair price for the work. Before any asbestos abatement work begins, the contractor should conduct a thorough inspection of the area to identify all asbestos-containing materials. They should also develop a detailed plan for the abatement work, including the methods that will be used to minimize dust and protect workers and the public. During the abatement work, the contractor should use specialized equipment such as HEPA vacuums and negative air machines to control dust and prevent asbestos fibers from spreading. They should also wear protective gear such as respirators, gloves, and coveralls. After the abatement work is completed, the contractor should conduct a final inspection to ensure that all asbestos-containing materials have been removed or encapsulated. They should also collect air samples to verify that the air is safe to breathe. If you have any concerns about asbestos in your home or building, don't hesitate to seek professional advice. A qualified asbestos inspector or abatement contractor can assess the situation and recommend appropriate solutions.